became a nurse at Cancer Treatment Centers of America. I was a new nurse right out of nursing school, and I felt very comfortable. I had a preceptor, Sandy Veda. She was wonderful, and she was right by my side for probably a good 3 months of training. We have great mentors here, and you never feel like you're alone here.
And didn't really know what to expect when I came, to observe and to interview. And when I got here and met people, I was just blown away by the people, blown away by the services that we offer patients. Everybody here just, has one goal in mind, and it's providing amazing patient care.
I just feel so privileged to be able to work here. Every patient that walks into our unit, walks down the hall, is one of our family. Every day that I come to work, I truly feel inspired to want to do better. I see my coworkers, all of them, doing such a wonderful job and always going that extra mile, and it makes me want to do better.
They not only empower you to spend the time with your patients and really get to know your patients, but it is almost an expectation. And cancer treatment centers, bar none, is always patient first and very patient focused. And to me, that's why we're here, is for the patient. And the fact that I work for a company like Cancer Treatment Centers of America that allows me to spend that time is very important.
I'm the manager of infusion and the ambulatory clinic here at Western Regional Medical Center. Cancer Treatment Centers of America is a pretty unique place to work. I've been here now for about 1.5 years, and I can tell you that we walk the walk here at CTCA. We have everything from nutrition to mind and body to pain management, all the way up to their oncologists. It's a different atmosphere here than any other hospital. We want to work together as a team to make sure that our patients are provided for. I've been a nurse for quite some time, and I can tell you that up until recently I've never seen anything like this before, where nurses actually want to help each other out and come to work with a smile on their face each day, just to make sure that our patients are well taken care of.
I think if you ask any staff member or any patient, they'll tell you that CTCA does not feel like a normal hospital. As far as the different kinds of services we offer to our patients, we don't act like a typical hospital. We really do cater to the needs of our patients. It's not cold, it's not white, it's very warm and inviting, and not only is our facility warm and inviting, but our staff is as well, and it's something I'm proud to be a part of.
I've never worked at an institution that has provided more ongoing education than here. And oftentimes at other places they've actually offered it, but then not been able to follow through because of scheduling or budget constraints. But here, I've done more here than I have in any other place that I've worked at, and I've worked at a lot of places in my career. And already here I've done a critical care class, I've done a oncology class, a chemo class, so I'm just so pleased with that.
We have opportunities if your learning style is more online, we have a lot of CEUs available online. Otherwise, we also have classes that are brought to us and we can participate in. In the time I've been here, I've gotten my ONS, my chemo certification. I'm able to, right now, if I want to do some leadership training, I have that available to me also. You
fulfill yourself in your nursing career. You nurture the patients and the families, and you have wonderful support from your team, your coworkers and your peers, and it's just a great place to work, a great loving place.
The mother standard of care is treating every one of our patients the way that we would expect our mother to be treated. And we normally don't treat ourselves the way that we treat our mothers. We treat them much better than ourselves. So we treat every patient like they're our mother, and that's the bottom line. We do whatever we have to do to achieve that.
When I hire my nurses, the first thing I look for is compassion and the ability to provide the mother standard of care. Would you want your mother treated like this? And that's what I look for, and that's what I ask all my candidates before I hire them.
The patients come first, but it's the people I work with. We come together as a team, whether you're a PCT or a PCA, if you're a nurse, if you're a doctor, you come together and just work as a team. I've come from a very large hospital, and management is management. You always hear, oh, I have an open door, come and see, but they're not available. Here they are. You walk by them in the halls all the time, you pass people, people know people. In fact, part of our orientation is we want to know what your name is. We like to say, hi, how you doing? We check in with people. Everyone's always got a smile on their face, and we always interact with people who are way up or people who are down low. We stop and talk to the housekeeper, we stop and talk to the VP. It's great.
come and walk the walk with us and see what patient care is really about and providing the mother standard of care. Honestly, it truly is a great feeling and a blessing to every patient that walks through our doors.